Hello everyone, I'm Dr. Runa Acharya, Consultant Reproductive Medicine and Surgery at Medicover Fertility Solutions, Hyderabad. Now, one of the common questions asked to us is what is the role of laparoscopy in infertility? Now, laparoscopy means a daycare minimally invasive surgery wherein we enter the abdominal cavity through small scopes which has cameras, and these let us know what's happening inside the abdomen of a female. So in infertility, what we look at first is whether the uterus, the tubes and the ovaries have a proper or a normal anatomy. So laparoscopy helps in diagnosis what could be the reason of a woman not conceiving. If there is some cyst or a tubal problem or fibroids or any pathology in the reproductive organs of a woman, these can be corrected through laparoscopy. The laparoscopy is again used to treat the tubal factors like fimbrial blocks, like fibroid myomectomies, ovarian cyst, cystectomies, endometriosis, and to restore the anatomy, clear the adhesions, wash and irrigate the abdominal cavity, take biopsies. The same scope when we introduce through the uterus into the uterine cavity, that's called as hysteroscopy. So in hysteroscopy what we see is how the lining of the uterus is, which is called as endometrium. Whether we are able to see a regular normal contour of the cavity, whether there are some polyps or adhesions or some septum in the uterine cavity, and if so, some of them can be treated. Like if there is a septum, we can resect the septum. If there is a polyp, we call it as a polypectomy. If there is adhesions, we call it as an adhesiolysis. If there is a tubal block at the opening of the tube, it is called as a tubal cannulation. So these are some of the things, few things which we do in hysteroscopy and laparoscopy to resolve the problem of fertility. Sometimes the laparoscopy is just diagnostic, and sometimes it's a planned therapeutic laparoscopy. So laparoscopy helps us in a lot of things to understand what is lacking or what is falling short of in a couple's drive to become pregnant.